Today, we're talking about the hip bone. It's the keystone of your entire skeleton, the literal bridge that connects your upper and lower body. But what if I told you that this single massive bone you rely on for every single step you take is actually hiding a pretty big secret about its own identity?
No, really, just think about that for a second. This huge, kind of weirdly shaped flat bone that we all think of as one solid unit is actually a composite. It's a puzzle that your body puts together long before you're even fully grown.
And here it is, the big reveal. The ilium, the ischium, and the pubis. See, when you're a kid, these are three totally separate bones. But over time, they perform this incredible act of biological construction, fusing together to form the single solid hip bone we all have as adults. So how does this whole assembly work? Well, let's meet the parts.
All right, first things first, let's get to know the three main players in this anatomical puzzle. Each one has its own unique shape and, you guessed it, a very specific job to do.
First up, we have the ilium. The easiest way to think of this one is as the big wing-like part right at the top. In fact, if you put your hands on your hips right now, that bony ridge you're feeling, yep, that's the upper edge of your ilium. Next, we've got the ischium. This is the thick, super strong foundation at the back and bottom of the hip bone. It's literally the bone you're sitting on this very moment, and it's built to bear your weight.
And finally, the pubis bone comes around to the front. Its job is to complete the pelvic ring by meeting its partner from the other side. This creates a strong, closed loop. So, those are our three building blocks. Now let's see how they actually work together.
So let's start with the biggest of the three, the ilium. Its fan shape is absolutely no accident. It is perfectly designed to be a massive anchor point for some of your body's most powerful muscles.
And you can really see that fan-shaped description come to life here, can't you? It just flares upwards and outwards, creating those wide, supportive wings of the pelvis that are so characteristic of the human skeleton.
Now, that top edge you can feel is called the iliac crest. If you trace that ridge with your fingers, you're literally tracing it. It's got these specific bony points at the front and back that doctors and physical therapists use all the time as key landmarks for diagnosis and treatment.
And that crest isn't just a bony border, it's a major docking station for muscles. For instance, the latissimus dorsi, one of the widest muscles in your entire back, it anchors right here. This connection is what gives you so much power to pull, lift, and twist. Tucked away near where these bones meet are all these critical pathways for nerves and blood vessels. So to keep track of everything, anatomists use these clever little tricks. For a key group of structures that pass by a point called the ischial spine, they just remember the word pin for the pudendal nerve, internal pudendal vessels, and the nerve to the obturator internus. It's like a simple map for some seriously complex internal wiring. Okay, now let's look at the other two builders of the hip, the ischium and the pubis. These two form the foundation and the front of the whole structure, handling our weight and closing the loop. The ischium is basically your body's built-in stool. That thick, reinforced area at the bottom, the ischial tuberosity, it's designed for one primary job, to bear the full weight of your upper body whenever you sit down. Simple as that. And then the pubis, or pubic bone, swings around to the front to complete the puzzle. It joins up with its counterpart from the other hip, forming that strong, closed pelvic ring that does such an important job of protecting our internal organs. Okay, so we've got our three bones, but the real magic, and I mean the real magic, happens right where they all meet. Their fusion point isn't just some seam. It creates one of the most important structures for movement in the entire body. This meeting point creates something called the acetabulum. Think of it as the perfect biological ball and socket joint. It's this deep, cup-shaped cavity where the head of your thigh bone, the femur, fits snugly inside. This is the heart of the hip joint, and it's what gives us that incredible combination of strength and range of motion. And just look at how it's made. This isn't one bone's job. The ilium forms the top 2/5, the ischium forms the back 2/5, and the pubis contributes that last 1/5 at the front. It's a true team effort, with each bone bringing its own strength to form the perfect socket. Just below that main socket, the ischium and pubis also frame another big opening called the obturator foramen. Now, in a skeleton, yeah, it just looks like a hole. But in a living body, it's covered by the strong membrane.
This not only lets nerves and vessels pass through, but it also provides a huge surface for even more muscles to attach to. So now that we've basically assembled the hip bone, let's explore its functional design a bit more. We're going to look at some key differences between the sexes, how it develops over time, and what happens when this incredibly strong structure actually breaks. One of the most remarkable things about the hip bone is how it's adapted for different biological functions. The female pelvis, for instance, is specially engineered to accommodate childbirth, and that means it's generally wider and more open. Things like a broader sciatic notch and a different shaped foramen all work together to create a larger pelvic outlet. Man, this bone's journey from parts to a whole is a long one. The 3 primary pieces start to form as early as 2 months in utero, but they don't even start fusing until you're a teenager, around 17 or 18 years old. The whole process isn't finished until you're in your early 20s. That's when you finally have one solid hip bone. But despite all its strength, the hip bone can fracture. This usually happens in one of 2 ways, either a massive direct impact, like you'd get in a car crash, or from indirect forces traveling up the leg, like from a really hard fall right onto your feet. And when a hip fracture happens, the danger isn't always just about the broken bone itself. The real risk, so often, comes from collateral damage. Because the pelvic ring acts like this protective shield for vital organs, a fracture can easily injure the bladder or urethra that are nestled just inside, and that can lead to really serious complications. So from 3 small pieces of cartilage into one solid weight-bearing structure that lets you walk, run, and sit, the hip bone truly carries your world. It really makes you wonder, doesn't it? What other incredible feats of design are happening inside you right now, completely unnoticed?